My population is on those that are auditorily impaired. People of this population experience either complete or partial hearing loss. For some individuals, hearing loss may be temporary, and for others it may be a complete hearing loss or a partial, and they are considered hard of hearing. This therefore puts the members of this community at risk for health disparities. The biggest reason and cause of the health disparities are communication with the deaf and hard of hearing individuals and those in healthcare. Some statistics. Statewide, about 15.9% of people 18 years and older experience hearing loss. Nationwide, about 14.3% of the American population experience hearing loss, and about every 2 to 3 children out of every 1,000's birth are deaf or have partial hearing loss in one or both ears. Internationally, about 5% of the population are considered deaf or hard of hearing, and the differences in the percentage of state versus nationwide may be due to the fact that people in Utah tend to have larger families, therefore creating a higher chance of the child being born deaf or hard of hearing. Their social determinants of health is determined to be their access to education and the quality of their education. This may be due to lack of schools that have sign language, prejudice against hearing impaired individuals, and their struggle to find work. Contributing factors of specific health concerns: economic-wise, more difficult time finding work, thus creating a financial burden, also their lack of education. Psychosocial-wise, deaf individuals may grow up feeling different or judged and may feel that something is wrong with them. They may also have a difficult time understanding others or feeling or being understood by their peers due to the communication barrier between the two. Some of the root causes. The issue that I'm asking is, why are individuals who have hearing loss a vulnerable population? Starting off, there is a language deficit. It is more difficult to communicate, and it usually takes longer to use an interpreter or to write information down. Healthcare staff, as a result, may not take the extra time needed to communicate effectively because it can be considered inconvenient for the provider to use interpretive services because it takes more time. According to the Maslow's hierarchy of needs, the met needs are physiological safety and love and belonging. Their unmet needs may be esteem and self-actualization. The functional level of this group is functional. Most are able to grow up and work, and they meet the first 3 basic needs. Within the community, especially the deaf community, there's been an increase in culture and access to knowledge and explanation on culture, and that's creating a strong sense of belonging and unity. And some likely health outcomes: the individuals of this population are at a higher risk of healthcare deficit due to the difficulty of accessing education and the communication barrier between healthcare professionals and deaf individuals. Some specific concerns regarding communicable diseases or infections. Yes, there is a higher risk. The examples that I found included HIV. This is due to the issue with communication and the difference in language. There needs to be use of interpreters if these people sign in order to ensure that they are understanding. And if they don't know sign language, sometimes due to the lack of education, members of the deaf and hard of hearing community may have lower levels of reading. Some ways to improve communication is to provide better interpretive services that meet each individual's need, and therefore enhancing their understanding. Regarding non-communicable diseases or infections, there is also a higher risk of that. The diseases that I found were diabetes and hearing impairment. This is due to the fact that there's less general health knowledge. Sign language may also not have appropriate signs needed for certain medical conditions, and healthcare providers lack an understanding of the deaf and hard of hearing culture. Some ways to improve this is to develop a communication strategy that increases the communication, and it should be specified for that individual and their level of reading and or use of sign language. In addition, more research/studies on deaf and hard of hearing culture needs to happen in order to better understand their needs. They are at a higher risk of self-care deficit. Communication is the number one reason. However, due to this fact, deaf and hard of hearing individuals are less likely to seek out healthcare. They may also not understand what is communicated to them due to not understanding health terminology, but there not being signs available to explain that terminology. Studies have also shown that lip reading isn't effective in medical offices and medical staff not understanding their culture. So some ways to improve is to improve knowledge of deaf and hard of hearing culture for medical staff. Learn how and the best way to provide interpretive devices, whether that's calling in an in-person interpreter or having a video interpreter. And you can make sure patients understand by using the teach-back or demonstration method. Specific concerns, risk for harm by or to others. So they are at a higher risk of being harmed by others, and this is due to simply having and experiencing hearing loss. Those with a disability are already at a higher risk of experiencing violence than counterparts without that disability. They also have an increased possibility of psychological stress, especially in teenagers. Some ways to improve that is provide parents of deaf and hard of hearing children resources to better understand their culture, and also provide them resources or programs to learn sign language. That is the best way. Studies have shown that's the best way for deaf children to grow and form a communication and a language. And those are my references.